I would like to ask Zoran to the stage. Zoran will tell us about a completely implantable hearing aid. Yeah?
So, ladies and gentlemen, at first, you are welcome to my presentation. As Markus said, I will talk about one implantable hearing aid microphone that is aimed for use in combination with cochlear implants. So, as you have heard, my name is Zoran Djinovic, and I'm coming from Austrian Center for Medical Innovation Technologies from Wiener Neustadt. This is a city about 50 kilometers in south from Vienna. And of course, here is the core team. Two surgeons, Dr. Robert Pavelka, Primarius, that is working now is retired, but he was head of ENT department in Wiener Neustadt, and also Professor Georg Sprinzel from University Hospital in St. Pölten, and my colleague Dr. Miloš Tomić from Technical Institute of Science at Belgrade. So, do you hear me well? Okay.
We need your
that's good, really, because I could say that we are happy, of course, because we have no problem with this. But unfortunately, you see, there are so many people that cannot do like we. What does it mean? From WHO report for 2021, you can see that about 1.5 billion people have some kind of hearing impairment in sense of problems to hear well. So about 430 million people, I mean adults, and also about 34 million children, they also need some kind of hearing aid. And the situation is getting to be worse and worse, and according to the same source, they found that to 2050 it will be about 2.5 billion people that need some kind of hearing aid. That's really a huge number, you know. So, but what is the state of the art? How we can do to help these people? I would like just to remind you on basically there are two kinds of hearing problems. So one is so-called conductive, and it's connected mostly with the transfer of sound pressure, let's say, or sound generally through outer ear, through the ear channel to the middle ear, and then to inner ear. And it's typically connected with or associated with some problems about middle ear and also this, let's say, three ossicles movement. And it can be handled or managed relatively easy by behind the ear hearing aids, let's say similar like this. Probably most of us actually have seen this, how it looks like just behind the ear. But generally, each hearing aid is composed of two main components. That's a microphone, typically, doesn't work so good. Microphone that is typically connected with this audio processor, and also one, and this is actually receiver in this sense. And also actuator, it's typically loud speaker, you know. In a classical way, it's some kind of silicone tube that goes near to tympanic membrane, you know. But when we are speaking about second kind of hearing troubles, it's actually all of this connected with the inner ear and with this is so-called the sensor-neural dysfunction. So it means that in cochlea and in Corti organ, these cells or hairs, let's say, they actually lose the ability to transfer the signal toward the nerve which it's connected to the brain. And people, of course, found some solution. This is practically this cochlear implant. You can see here this white color device. And it works, let's say, pretty good. One of the biggest companies in the world is actually one Austrian company with the name Medel, sitting in Innsbruck, and there are maybe 2 or 3 more. One is in Australia, also with a similar title. It's Cochlear, etc. So, but what is here interesting? They have just one electrode array in shape of one tail, and this array actually comes through this cochlea, and using this microprocessor here, they are able actually to excite the nerves inside of inner ear. But for this function, they need to have a microphone that can actually measure what is the intensity of sound pressure that comes from environment, you know, and then to process this signal and to send to this antenna, and de facto this signal to transfer in the school. And because of that, it's important actually to have this antenna that is aligned to counterpart to antenna that is integrated, let's say, and implanted in the skull of the patient. And you can see, of course, that it's a really very big problem, because it induces, how to say, so many different things, like, for example, stigma, let's say, or not comfortable. It's impossible to bathing or swimming, or simply to keep the everyday life, you know, in normal way. And because of that, we would like actually to jump on how to exclude these 2 things from outside. The audio processor with microphone, and this antenna you can see here on this picture. And only to use our microphone that is implantable, and to cope or to combine with the state-of-the-art cochlear implant that works properly. And here is a schematic presentation of our discovery, or our approach, let's say. This is this frame schematically presents actually that it's the implantable microphone, and basically it is a kind of fiber optic interferometer, or more precisely one vibrometer. And the core of this is this let's say case of we said totally implantable fiber optic system, and it's connected with the fiber optic probe that is actually aimed toward, for example, incus, and measures this signal through light, de facto, or changing some characteristic of light. Yeah, okay. So, and the output signal comes to again to this and to cochlear implant, you know. And you can see how it looks like today. So this is an optoelectronic unit, 23 millimeter in diameter, composed with one laser and 2 photodiodes, and of course with the optical fibers that goes toward the incus. Here is some results that we already did by preclinical test on some cadavers, and you can see that we are able to measure the amplitude of vibration from 200 microns to 10 kilohertz, and in different dynamic range from 40 to 90 decibels. And maybe you can see here that we are able to measure the amplitude of vibration of just 1 picometer or even smaller, you know. And finally, so as I said, we are addressing here the hearing loss problem. And what are actually our advantages in comparing with the state of the art? So our system is really very sensitive because it's interferometric based, and provide a very good sound fidelity in quite a big dynamic range. This is a contactless technique, and it is a unique in this subject. And also, we preserve the complete this natural acoustic gain. It's very important. And of course, benefits from society. So we are going to help the people which are affected and to include these people in normal life. And maybe you know, maybe not, but there are so many, quite a huge amount of money that society needs actually to help these people with hearing problem. So next steps in our investigation is actually to integrate our microphone with cochlear implant, and for this we need help or to include some partner. And I would like, I don't know, how can I actuate this? Unfortunately. Okay, I wanted to demonstrate one live signal that we actually catch to demonstrate the high frequency, how high frequency signals are able to catch. It's not the simple only talk, it's also music recorded during this cadaver test.
Thank you, Zoran.
Thank you very much.
Yeah.